Hi guys, I'm Sharon and I had Tetheredcord surgery December 20th, and I want to share with you my experience being at Rhode Island Hospital. My surgery was performed by Dr. Petra Klinger, who's amazing. 10 out of 10, recommend her. The hospital there's no other way. It's a shit show. No pun intended, it's a shit show. There's so much, but I'll try and make it short and sweet. So after surgery, you have a walker and you have to be helped to go to the commode or a bedpan or to the bathroom. And it would take a CNA or a nurse to show up about an hour to an hour and a half. And you can keep calling them as much as you want. They are understaffed, and shame on you, Rhode Island. Let me tell you what that entails. So if you're right out of surgery, you cannot get up, and it's just not possible. You need to talk to a physical therapist to be able to walk to a commode, so you're in a diaper, and or a bedpan is where you should be going. Well, if they don't come and there's no bedpan, and you are going to need to have someone there to help you clean up, which my husband did. I was really a little frustrated, spoke to a CNA, and I'm like, what happens to people if they don't have someone here to help them change a diaper, or so they're not sitting in their own stuff because they've had an accident because of the medication and they're out of it. She goes, well, we don't want them to feel bad. We're very careful about not making them feel ashamed. They have nothing to be ashamed of. So I said, so if they have no one here, they're literally going to be sitting in feces for an hour and a half. And she's like, yeah, that sometimes happens. What? Are you kidding me? So my husband would show up at 10 a.m. and wouldn't leave until 7 p.m. because they were very strict about having visitors. He could not stay overnight. At night, I would sit there hearing people scream, help me, help me. And they'd be screaming, oh, I'm in pain. Like a horror movie. I cannot tell you or describe to you. And then they leave your door open. So you're trying to sleep and recover from surgery, and this is all you hear all night long. I wanted to record it, but it kind of went on that privacy where I felt like maybe it was infringing on the patients that had that happen to them. So I just didn't feel comfortable about that, but it was pretty bad. Second, they did not have my medication ready for me when I came out of surgery. Did not have any medication ready for me when I had my asthma attack. They didn't have any albuterol, no nebulizer treatments. They had to get an oral scanned in and sent over to the pharmacy. So by the time I got my asthma medicine, I had already had a full-scale asthma attack. I asked to have a respiratory therapist twice, was denied. They said a physician's assistant would be the one taking care of me because it was a mast cell issue. So I would not recommend this place. I would have surgery somewhere else. And I'm going to be very frank and blunt with Dr. Klinger about the aftercare, because I don't think she's aware of it. She's so detail oriented and so amazed by it. I will be filing an official complaint. I have a friend who I think can give me some legal advice. This really needs to be addressed. There's something wrong at Rhode Island. I don't know if it's the holidays and they are that short-staffed, but I had nurses that didn't know how to handle my asthma. I had no medication when I was having an asthma attack. I was left to figure out what to do when I had to go to the bathroom. I mean, I could either pee or poop in my diaper and then wait until someone changed me. I didn't even wait for a physical therapist to give me the go-ahead to start walking around. I walked myself with a walker to the bathroom before I got the permission to, because I was not going to sit in that diaper at night. And nobody said to me, oh, you shouldn't be walking by yourself. I'm like, oh, you're glad you got to the bathroom. So many safety issues with this hospital. I can't even tell you. I will never, ever, ever go there again. It's just not going to happen. And I will be addressing it. But if you guys are considering this is maybe something you want to talk to Dr. Klinger about. I looked at the reviews of the hospital. This happens all the time. I'm not an isolated case, which I was hoping I was. There's a serious problem, and I don't know how they haven't been sued at this point. I never got to the point that I felt like it was that bad. Thank God. I was able to advocate for myself, or my husband was. I am just shocked. Rhode Island, You got some cleaning up to do. It is a shit show over there, no pun intended.